Hello, everyone, and welcome to Northern Medical Center's second webinar. Today, we're very fortunate to have Dr. Jingduan Yang back with us today to talk about acupuncture and COVID. This is our second in our webinar series, both times dealing with COVID and things that we can do to help protect us against COVID. Our first one was such a success that we asked Dr. Yang to come back with us again today. We all know COVID has played such a major role in everyone's life over the past year and continues to play a major role. It's affected all of us in many, many ways. Many people are asking, is there anything we can do to protect ourselves from getting COVID? Or once we get COVID, is there things that we can do to get over COVID quicker or any of the symptoms of COVID? So today we'll discuss that further with Dr. Yang. I'd like to again introduce myself. My name is Dr. Damon Noto. I'm the medical director at Northern Medical Center. I'd like to spend a minute just talking about Northern Medical Center because it's such a new center and many people may not be familiar with it. Northern Medical Center started seeing patients in January of 2020. Right before the pandemic started, we started seeing patients. We have three pillars that we believe in. One is giving very outstanding medical professional service and compassionate care. Second pillar is giving outstanding service, caring about our patients. Also just being compassionate individuals. Our approach is slightly different than maybe other medical centers. We do believe in treating patients as unique individuals. We believe in comprehensive care. We believe in trying to enhance a person's health instead of just suppressing a symptom or a disease. And we do believe in using integrative methods to treat people, not just allopathic medicine of using medicines or surgery, but we believe in other things like acupuncture and holistic type of treatments such as nutrition, exercise. So we definitely believe in being preventative, restorative, trying to get the person back into a good natural balance of themselves. We have several current services, first one being primary care and internal medicine. We also have rehabilitation medicine, and we have acupuncture and Chinese medicine. We do plan on bringing other specialties in the near future. We are a place that believes in research and education. We're a big believer not only educating the public, but also educating future medical professionals. We have some active research going on with data analytics, and hopefully we'll do something with COVID in the near future. Saying that, now I'd like to introduce Dr. Yang again for those of you who were not here during the last presentation. Dr. Jingduan Yang. He is a leader, an expert in the integrative medicine field. We're very honored and privileged to have him. He's a board certified psychiatrist. He's done a fellowship in integrative medicine at the University of Arizona with Dr. Andrew Weil, who is very famous in the field. He's a fifth generation teacher and practitioner of traditional Chinese medicine. He does specialize in acupuncture. He received his training in neurology and psychiatry, one of the most prestigious hospitals in China. He completed a research fellowship in psychopharmacology at Oxford University. He was a resident at psychiatry at Thomas Jefferson University in Philadelphia. He's a faculty at University of Arizona Center for Integrative Medicine. He speaks regularly at medical conferences and professional organizations. He's authored two books, one called Facing East, as you see there. Another thing, he's been featured in various media organizations, including New York Times Magazine, ABC, NBC, etc. Currently, he's the medical director of the Yang Institute of Integrative Medicine with locations in New Jersey and Pennsylvania. It's my great pleasure to welcome him here today again. So I will hand off to Dr. Yang. Thank you again for coming.
Thank you for inviting me.
Okay, we'll now pull up his slides and we'll let him begin presenting on acupuncture with regards to COVID and chronic pain.
Thank you, Damon, for very kind introduction. Most people know acupuncture is because its effectiveness for treating chronic pain, and but acupuncture actually as one of the major therapeutic tools in Chinese medicine can help various kinds of illness and disease. And at the time of the COVID pandemic, acupuncture can contribute a lot more than we realize. So today, I would like to take this opportunity to introduce how acupuncture works and how it works on the pain, but also how it would help at the post-COVID care, if you will. So I would like to start with a case study. I hear some sound feedback from other side. But anyway, the case study here is 75-year-old man who is high-performing business executives and who had a history of metastatic prostate cancer in remission. And he developed a sudden onset of severe lower back pain, and that radiated along the side and the back of his legs. He was not able to walk more than 1 block due to the severe pain for 4 months. And of course, he was investigated with MRIs and found out that he had degenerative changes in the lumbar and the thoracic spine, which were not something new. And he was not able to tolerate the painkillers, and because the side effects, besides he doesn't want to feel muddle-headed when he is taking those medications. And one of his best friend actually was top orthopedic surgeon in the country, and but they decided not to do any surgery for him. It's too much risk. So that's the circumstances where he had exhausted everything and decided to try acupuncture. So here, Alan get a 1-hour evaluation and a lot of history taking, pulse reading, tongue diagnosis, and so on and so forth. And so he got diagnosed as stagnated qi and blood flow along the meridians of kidney and gallbladder. So that's one thing. Then have a kidney insufficiency and the liver qi stagnation. That I would say there's a kidney and the bladder and the gallbladder, I would say, to make a little correction there. So this is a Chinese medicine diagnosis, is always identify what a organ system is involved, what energetic network is involved, and what kind of problem is deficiency or stagnation, and so on and so forth. So this is a typical Chinese medicine diagnosis. So if you go to see a Chinese medicine doctor or acupuncturist, you'd better ask for this type of diagnosis rather than saying, oh, you have a COVID or you have a sciatic. And they need to give you the Chinese medicine energetic diagnosis, okay? So because this is what is based on for treatment. So Alan got acupuncture 2 times a week, and he also took a herbal remedies, and he received a psychoenergetic therapy once a week. I will explain a little bit about that later. So in about 4 weeks, actually 4 to 6 weeks, Alan was able to reduce his pain level from 10 out of 10 to 2 out of 10. He was able to walk continuously for 5 avenues. He works in New York. He had improved mood and temperament and have improved sleep. And of course, we go back to check if MRI made it, if acupuncture made MRI look different. No, MRI looked the same. This is worth noting because I remember he asked me a question, say, is it possible my mood can get better as the acupuncture helps? My answer to him is that you have a pain radiating along the liver gallbladder energy channel, and these 2 channels are extremely sensitive to emotion of anger, resentment. So if we ever want to help improve the pain along those meridians or energy channels, if you will, and then we have to help get rid of some anger, resentment from you. But anyway, that was a long story about the emotional distress, because people think, okay, this is all coming from the spine or disc or degenerative changes or spinal stenosis. Yes, he does have that. However, what we see on the film, MRI film, does not explain why he had pain, because those film would have been looking like that probably for years. But why he suddenly developed the pain only in the last 4 months, right? What happened 4 months ago that created these energetic blockages? Actually, the reason was emotional stress. And so that is how acupuncture works in his case. Of course, there's tons of many individual cases like this, and the question would be, does it work for everybody or only work for Alan? So there are many studies about acupuncture, and most of studies are not very high quality. So that's why for a long time there wasn't any conclusion about how acupuncture is effective or not. Whether acupuncture is effective or not in helping chronic pain until 2012, and there is a major article analyzed selectively the high quality studies and come up with a conclusion. So I'm going to tell you a little bit about these studies. So basically, everybody know acupuncture is widely used for chronic pain, but people do not know whether it works in some cases, in some cases not. I once read an article from British Medical Journal to say acupuncture doesn't help with a tennis elbow, and they only use 1 needle, stimulate 1 point, and claim it's not working. And then the claim is not work. The acupuncture doesn't work. So the question is, there's many different type of studies and design, and that very much affect the outcome because the quality of it. So in order to do that, so they picked the 4 chronic pain conditions: back and neck pain, osteoarthritis, chronic headache, and shoulder pain. So they pick up all the systematic review, identify randomized controlled trial of acupuncture for chronic pain. So you probably know these RTCs are standard for pharmaceuticals to test whether something is working or not. And those data were analyzed. So they picked 29 out of 31 eligible random controlled trials, and together about 17,922 patients. So it's a big database. So in these results, they discovered in all the studies, the acupuncture was superior to both shame and no acupuncture control for each of these 4 pain conditions. So what is a shame acupuncture? Shame acupuncture, as you can tell, they're trying to mimic acupuncture, but not actual acupuncture, so that they can use it as a control, because they do not want the acupuncture efficacy is a placebo, so-called. It's interesting people think that way. Placebo implies the people's believing something going to work, and therefore they feel the positive results of it. But most people, in my opinion, experience, coming to acupuncture not because they're believing in it, it's because they have nothing else they can do about it. They actually come in disbelieving, just to try their luck, because they are desperate to do something to feel better. So we call them nocebo effects. The shame acupuncture is normally used to either not puncturing through the skin, like acupuncture needle would do, or that stimulate the points next or around the away from the acupuncture points. Is that going to be shame enough? We'll talk about that later. Actually, there's a bigger problem with this kind of design, because acupuncture is working on human energy, which is very sensitive. But anyway, all the results shows that the true acupuncture works a lot better than the shame acupuncture, and the shame acupuncture works better than the no acupuncture. So of course, the question about, but this is significantly different. So this is for the first time they concluded the acupuncture is effective in treating chronic pain, including back pain, neck pain, arthritis, and headaches. So so this is a publication probably responsible for most private insurance began to cover acupuncture, and actually Medicare began to cover acupuncture as well. So here's the conclusion: acupuncture is effective for the treatment of chronic pain, and therefore is a reasonable referral options. There is significant difference between true and shame acupuncture, indicate acupuncture is more than a placebo. The reason I want to say this, in many studies, they think shame acupuncture also works, is because they're not shame enough. Acupuncture point is not just a point, it's a small area. And besides, there are so many acupuncture energy channels and points that are very close to each other. So you can't really get away from hitting another acupuncture point. And they are all connected energetically, so it's hard not to affect each other. Even you touch the skin, acupuncture works on the energy, and skin has the energy too. Skin has energy channel as well. So energetic intervention does not necessarily involve a physical contact. People can attack each other energetically through words, through facial expressions, through voice, and so on and so forth, through looks. So the energetic, impact is very powerful and very sensitive too. So people then, what is acupuncture then? So acupuncture, people know, is involved in inserting these small needles on the selected acupuncture point on the surface of the body. And this is not the needle we think about. It's a very fine needles. And the acupuncture point is connected with energetic network, and that connect with internal organ system. So people would ask, what is the energetic? We know nerves, we know arteries, vascular system, we know nerve system, but what is the energetic system? The energetic system in Chinese medicine is the system that with the energy flows, just like the blood flows inside arteries. as invisible as the energy itself, like the air. We don't see it, but it does exist. Same thing within the body, there is energetic channels as invisible as energy itself. Again, we can't verify that. Whoever created Chinese medicine, they have the ability to visualize it. So they documented, they map it out for us. So we are basically use it as it is the fact. How do we know it is fact? Well, the clinical results will tell us as one of that. So the acupuncture, the real acupuncture, has to be based on the complete medical system and theories of Chinese medicine. It should involve a very complicated diagnostic process. And of course, very similar to modern medicine, you have to ask a lot of questions, histories, the factors involved in the precipitating the problems, maintaining the problems, and so on and so forth. And there are some special diagnostic tools Chinese medicine uses. One is a tongue diagnosis, the other is pulse diagnosis, because both will tell us how the body is doing energetically. And so if you go to acupuncturist or Chinese medicine doctor, you'd better ask them or pay attention if they check your pulses or read your pulses or check your tongues. At least you know if they practice acupuncture that is based in Chinese medicine. They have to carefully select a point. Normally, wherever there's a problem, you can select the problem in that area. And also, you can select the points in the opposite area, which is very effective. And you can go as opposite as left hands, you go to the right feet, and that kind of opposition points actually produce very effective results. If you think about why, well, you think about how a scale balance each other. And it's not just to put the needles in. And the needles in, insert the needles in is only first step. You have to touch the energy. You have to manipulate the needles. Some technique will reduce the energy flows, create the coldness. Some manipulation will facilitate the energy flows and actually generate warmth inside the body. It all depends on what you want to accomplish and where you want to accomplish it. So the technique is very, very important. Again, the acupuncture is not just a one-time thing, just like everything else. Healing takes time and takes process, and there's a course of treatments needed between some acute short conditions, maybe 6-12 sessions, and some chronic conditions can go as long as 36 or 48 or even longer, many weeks long of treatments. In China, people tend to get acupuncture every day or every other day. Here in the United States, people get it once a week, twice a week. But whatever they get is still a very important care, because we have medicine taking care of our structure, and we have medicine taking care of our biochemistry. But we don't have a medicine taking care of our energy. And the energy is what life is about. And without energy, we can still have the structure and the chemistry, and we can be dead. So taking care of the energy is very important. I always say the acupuncturist to human body is like electronic engineer to a car. And it's very important. Okay. So there are many different ways we understand how acupuncture works. And from Chinese medicine perspective, acupuncture is purely interacted with human energy. And this is a picture I generated artificially based on the description of Yellow Emperor's Book of Internal Medicine, which was put together about 2,500 years ago, which appeared to be a complete medical system. That's why I tend to believe the Chinese medicine was not created by Chinese in the last 5,000 years or 7,000 years actually is inherited by Chinese from a previous civilization in which a medicine was and technology was much more advanced, and they had the ability to visualize the human energetic system like what I trying to present here. This is a liver and gallbladder energy channels. You can see they're not just a liver gallbladder. They're connected from tools to the head, to the brain, to the internal organs. Very complicated. So this is just like today we have technology to visualize bones, calciums, water through the X-ray machine, CAT scan, and the MRIs. But they had the capacity to visualize energy. So that's how acupuncture works from the Chinese medicine perspective. Because energy, as long as we have energy that we're alive, that's a good thing. But energy is also very sensitive. Energy can get stagnated, meaning stop moving easily. Not like blood. To stop blood moving is not that easy, but to block the energy flow is very easy, because energy is very sensitive to environmental energies, to emotional stress, to lifestyles. And so also the energy can move in the wrong directions. You want energy to move in the right direction. If you want to digest the food, you'd better moving the energy down, right? And if you're moving up, people will get nauseous, get vomiting, and even get hydrohernia and heartburns. And for the lung, it's the same thing. Whenever the lung is attacked by COVID, for example, and then the energy began to move in the wrong direction, people began to cough, began to have short of breath, and so on and so forth. So the energetic explanation is what Chinese medicine, how Chinese medicine works. But of course, it's hard to help people to see that. It's much easier if we check how acupuncture affect our biochemistry. Okay, this is an example how acupuncture actually can stimulate the brain to produce natural painkillers like endorphins, and can generate neurotransmitters like a GABA, which is a calming neurotransmitters, and also stimulate the 5-HT, which is serotonin and regulates mood, and so on and so forth. So acupuncture has a lot of impact on the biochemistry as well. And of course, people, now we see how acupuncture affect the brain activities, people using functional MRI and to study how acupuncture affects the brain activities. There's one study was very interesting because there was a point on the side of the leg along the gallbladder channels connected with the visions. So they stimulate that point, that they record the reaction at the occipital lobe where our vision information is processed. So they do verify the impact of acupuncture on the area of the brain. So that helps us understand how it works. So now acupuncture also improves blood circulation, and patients experience that, and people have trouble with cold hand, cold feet, and all that. And many studies shows it helps blood flow. Why this is important in the COVID, and I just want to say what COVID does is affecting us is not just biochemically. That's what we understand, but it affects us energetically. Why we have a fever? That's energy, right? Why we have pain, headaches, and that's energy. Why we have fatigue? That's a lack of energy. Why do we cough, right? That's also rebellious flow of the lung energy. So the virus is in Chinese medicine, there's no such a concept of virus or bacteria. They're considered as a pathological energies. So because they carry the energy that affects the body's energy. So the Chinese medicine is energetic medicine. That's why it uses such a terminology. So therefore, the acupuncture helps fight the energetic impact of the COVID infections. So we all know that today that people suffer from COVID and tend to have trouble with clots in the blood. And that's why the people with hypertension, heart disease, diabetes have a high mortalities from the COVID. And a lot of them is due to the thrombosis or the clot in the brain or in the heart. Okay. So acupuncture help facilitate the blood circulations, actually help reduce the platelet congregations. So that's another reason the acupuncture can be very helpful in the time of COVID. And some of you probably know that the some people who have received the vaccine either developed bleeding or developed the clots in the blood. Again, that shows how the imbalance have happened in these people. And acupuncture is very good at modulate those scenarios, not produce one way or the other, because some medication to thin the blood then can cause bleeding. Some things can help stop bleeding and create the clots. So that's really the problematic. So acupuncture also can help regulate glucose levels. We know the people suffer from diabetes are are high risk of developing severe COVID and risk of death. Actually, the scientist has looked into over 61 million hospital record and discovered that 30% of people who died from COVID all suffer from the diabetes. And if you get rid of all the factors like socioeconomic differences, the age or racial differences, and other medical conditions, the diabetes, the type 1 diabetes patient has 3 times more risk of death than the people who don't have diabetes. And diabetes 2 would have 2 times the risk of death than the people who don't have diabetes. So acupuncture help control the glucose, and that is very, very significant. That means it help the people with diabetes and to be better shape and be more resistant to the develop severe cases. And these 2 figures shows how it affects the glucose and also how it affects the long-term glucose levels. So another thing is acupuncture and blood pressure, okay? And the reason why I present here about acupuncture blood pressure, because high blood pressure is another risk factor for the COVID patient. And now we not only have COVID, we have a post-COVID, we call it long haulers, because 20, maybe 30 even % of people continue to suffer from symptoms after they've recovered from COVID, meaning their test has become negative, but their symptoms continues. And the question is why? And I think 2 things need to be considered. One is these patients have never been diagnosed, treated energetically. They've only been treated biochemically. And the human body is a energetic being as well. So the second, of course, some people have genetic predispositions, so they have nutritional deficiencies or other issues to begin with. And the COVID have triggered those problems, therefore the symptoms continues. Just like people who suffer from PTSD, not everybody suffer from the acute trauma would develop PTSD, but only those who have a predisposed risk factors more likely will become a patient of chronic PTSD. Same thing here. It's all individual susceptibility determine that. So the acupuncture can help treat the energetic impact of the COVID. Because if you're a doctor, you will hear patients say, I'm tired, my brain, I can't think clearly, I'm dizzy, I have pain, I can't breathe well, and so on and so forth. They have a lot of energetic imbalance, so the acupuncture can help. And of course, by reducing high blood pressure is critical in preventing people from developing serious the COVID and reduce the risk of death. So there's a serious study about how acupuncture helped the blood pressure, and they use true acupuncture, sham acupuncture. You can see there's significant differences. Now, acupuncture on immune system. People who have the cancer and they want to see how the acupuncture can help the cancer, because cancer primarily is an immune disease. Body began to lose the ability to control the growth of the cells. So acupuncture, there must be more study, not only activate the natural killer cells, which actually there's a two kind of immune response. One is called innate, that's the non-specific response, a first response whenever we're attacked by the virus, and we're going to stop them and kill them. And the second response will be involve the lymphocells to develop antibodies and other cytokines to kill the virus or bacteria. So acupuncture does stimulate the immune system. In Chinese medicine, we have a specific name for immune functions. We call it Wei Qi or defense Qi, the energy that defend our system. Okay, and that energy very much depend on the function of lungs and the spleen. So if we can use acupuncture to improve our immune system, it will help us to fight COVID. And people nowadays think we have a vaccine now, it's great, we don't have to worry about, but it's not that sure, because we don't know how long the vaccine will protect us. We don't know how vaccine is effective in the different individuals. We know for sure a lot of factors affecting the effectiveness of vaccine. For example, if people didn't sleep well and even they're vaccinated, they don't produce the same amount of antibody compared with people who sleep well. And there are many other factors affect the vaccine's effectiveness. So even we are vaccinated, we still need to take care of our body nutritionally and energetically. So in China, acupuncture, herbal medicine are a part of the strategy fighting the COVID. And there are studies coming from China where the hospitals that integrate acupuncture, Chinese herbal medicine have a much lower death rate have a much higher recovery rate and the functional, the recovery of functionalities. But in the West, it's not possible. We're still very allopathic oriented, either procedures, machines, or medications, and so on and so forth. And the herbal remedies and acupuncture has not been integrated. And this is a case study by an individual who developed the COVID and have a lot of symptoms. And he self-diagnosed and self-treated himself with acupuncture and recovered. And so she wrote her case study and published it in the magazine Medical Acupuncture. Even though this is just one individual case report, in the clinic, I began to see a lot of post-COVID conditions, including forgetfulness, chronic pain, neuropathy, dizziness, tinnitus, short of breath, chronic fatigue, and anxiety and depression. So we're at a time, there are lots of challenges in front of us. So I hope this talk will open a window and doors when you think about taking care of yourself, and you can add additional dimension of care, the energetic dimension of care from the acupuncture and Chinese herbal medicine. And of course, good sleep, good diet, good exercise, good mood. Why they're important? Because they're all important to maintain a healthy energies. The Qigong exercise and Tai Chi and all be very helpful as well. So we can't change our genetics. We can't control the life circumstances a lot of time, but we can develop better lifestyle, and we can utilize the energetic therapies like acupuncture to help regulate our genetic expressions and prevent illness and promote health. So I hope this talk will open that windows and doors for you. Thank you for listening. I'm going to stop here and leave some time for questions.
Thank you very much, Dr. Young. Very informative. We do have, for all the attendees, a little box on the right-hand corner of your screen, an ability to ask questions. If you go to the comment chat section, you can ask questions for Dr. Young. And Dr. Young, we do have a question from an audience member here. You had talked about that acupuncture can treat symptoms, including the fatigue, muscle aches, brain fog from COVID. We have a question from an attendee talking about, is acupuncture helpful for people to regain their smell and taste after getting COVID? We do know that people get COVID can lose their smell and taste for a prolonged period of time, sometimes for a few days, sometimes weeks. So the question here is, can it play a role in helping that?
Yes, definitely. Acupuncture has shows it activate the brain activities. And as we know from the modern medicine perspective, the smell and the taste is all function of our cranial nerves. So it does improve that. But energetically, the smell is a part of the lung and meridians, non-energy channels. Of course, COVID is basically attacking our lungs, attacks lungs. So by improve the energy of the lungs, and it will improve the ability of smell energetically. And taste is interesting. Taste is the function of the spleen and the stomach, or digestive energy system. So acupuncture, by improving the function or energy of the spleen, stomach, can facilitate the recovery of the taste. So there are, in a way, acupuncture helps those conditions both through the central nervous system as well as through the energetic network.
So along those lines, when we think about organs, sometimes we think about for the liver, the role of just cleaning the blood. But when you're talking about organs, you're talking about the energetic system of that organ, correct? Which has a lot more impact than just cleaning the blood, correct?
Yes. So the organ, when we say that the organ, let's say the liver, is really the liver as a energetic center. It's not just the organ, it's energetic. It is an organ. It is a biochemical factory, but it is also an energetic powerhouse. Okay. And it has its energetic network connecting with the rest of the bodies and connecting with the other organ system. For example, liver, you will never think, anatomically think liver has anything to do with the nails.
Right.
But energetically it does. And so all the connective tissues in the body, doesn't matter where they are, the ligaments, the sinews, the collagens, the fascias, the membrane of the muscles, the nails, all the connective tissues have connected, nourished by the liver. The liver connected with vision, eyes, and the part of brain that conduct executive functions. So that's why energetically it has much wider coverage of the mental and the physical function.
If you could go back to the patient you were discussing at the beginning of your lecture, you talked about them having problems with the kidney and bladder. So can you explain how the kidney and the bladder organs would have a role in someone who has back pain or sciatica?
The bladder energy channels travels along the spine. And the kidney is located right in the lower back. And so kidney energy channel and bladder, they are yin and yang energetic partners. And so the reason the pain was shooting behind the legs, that's travel along the bladder energy channels. When it travel on the side of the legs, it travel along the gallbladder energy channels. So you're rehab doctor, so when people have sciatics, sometimes they're pain shooting on the side of the leg, and sometimes they're shooting on the back of the leg. And for you don't necessarily differentiate because it's all come from the nerve, the radical nerve system part. But for Chinese medicine, it's very significant. That means it involves two different energetic organs. But more interestingly, it's involved two different causes of the problem, because gallbladder channel is sensitive to emotion of anger, resentment, while the bladder and kidney, they're sensitive to emotion of anger, to fear and dreadfulness. And so I mentioned at the beginning the psychoenergetic therapy. Actually, the technique was the part of the psychoenergetic therapy is called neuroemotional technique. And that technique helps identify the emotional connections. In this particular case, I asked him, what happened 4 months ago? And he told me a story that he forgot about it. But the real fact is that he was very resentful at that time of the economic crisis, and his wife wanted to buy another multi-million-dollar house. It generated tremendous fear that financially they're going to be problematic. It's not because he doesn't have the money to do that. It's because it triggered a memory of the past when his family was in financial crisis and was in fear. And that's all triggered these energetic reactions and caused his pain. So that is the emotional distress part of it. So that's why he had a genetic degenerative changes in the spine, which made him vulnerable to have this problem. But what actually really triggered it and caused the pain was the emotional distress, and specifically the anger, resentment, and the fear. And the acupuncture just unblocked that, the energetic stagnations. And imagine if it is a structural, no matter how much acupuncture we do on him, it will not change anything, right? And only changes if it is a energetic. So not what happened in him doesn't necessarily happen in another patient, but majority of people with pain, even though there are structural abnormalities, there are always energetic blockage. So acupuncture can always help to relieve the symptoms and relieve the pain. Depends on how much is energetically contributed.
So am I to understand that each organ is associated with certain type of emotions, and those certain type of emotions can weaken the energy of that organ? Would that be correct?
Absolutely. That's why if we want to improve our immune system and become stronger in fighting COVID, we'd better do things that improve our mood, our emotion, and managing our stress better.
You mentioned that acupuncture can play a role in treating some of the symptoms and things that happen after COVID. Also, acupuncture can play a role in preventing you from getting those morbidities, those symptoms from COVID. Was that what you were saying?
I'm not sure that acupuncture can prevent people from getting infected, because we are constantly exposed to the virus and bacteria all the time, not just at the time of COVID. Before COVID, there were other viruses, other things, but we're not getting sick all the time, and we're not getting very sick all the time either. So I think we can't prevent people from infected by just receiving acupuncture. What happens is, if you have a better immune system, you can be infected, but you can defend yourself well. So a lot of people who had it being infected don't have symptoms. They're just you have a virus infection. It doesn't mean it will become a pneumonia or the COVID. You don't necessarily develop into COVID. So I think acupuncture can help with prevent things from worse, good, from the mild or to severe, from severe to the dangerous status.
Many of our attendees may not have had experience with acupuncture. You mentioned in the beginning that most people think of acupuncture, they think about getting treated for some type of pain that they may have had or have. Can you tell us, for those people who've never had acupuncture, what's the typical experience like going for acupuncture? Is it a painful experience? Is it pleasant? How would you describe it?
First of all, it is a scary concept to have needles inserted on your body. It's not pleasant, okay? So, but the needles that we're using, people associate the needles with needles they had it before, either when you have a shot or when you blood draw. But the acupuncture needles is a very fine needle. You can put 14 or 40 of them into a syringe. So that's a very thin needles. Second thing is that they don't have any holes in it. They don't inject anything into the body. So they're going very smoothly, and particularly when they're used guided with a tube, it generates very little pain or discomfort. The only time you get a little sting is when it hit the little vessels incidentally underneath. But most people begin to actually like it after getting to overcome the first psychological kind of a barrier. And because it really put them into deep relaxations. Actually, if I can, I actually just play one recording. I collect their responses, and this is from a gentleman that I did today. So see if I don't know why the sounds doesn't come out. Give me a second.
Sure.
So we have people who. Let me see if that works now.
Just whatever you're comfortable to say about your experience. The experience I had with the acupuncture was tremendous. I was having the acupuncture on my stomach, and it brought up a memory from many, many, many years ago. And I must have been holding that in my stomach somewhere. And the acupuncture released that and brought that memory back of when my dad passed away. So I thought that was tremendous to release that. And I felt lighter after that experience. And you mentioned something about the acupuncture. Since you started acupuncture, your blood pressure, your weight, and all that. And the other thing I've noticed with the acupuncture is my pulse is now like 71, 72 all the time. And I'm starting to lose weight using the acupuncture, and I'm much calmer on a daily basis.
Anyway, so we hear this kind of response all the time, and but people, this is a very typical American middle-aged executives will never think will receive acupuncture, but come to the point where he didn't know what else he could do, and now he referred by his son, and who was my patient, and tried acupuncture. And this is the people who came to acupuncture have no idea what acupuncture is, what it could do to them. But once they experienced it, they had a very good response because, again, acupuncture interact with human energies. That's very powerful.
I'm curious how many sessions he had to get that type of an effect.
Well, he started about 3 or 4 weeks ago, and he get twice a week treatments.
That's wonderful.
Yeah, and his heart rate used to be 95, 98 all the time. And yeah.
That's wonderful. One of the last questions here for acupuncture, the role of the needle. You mentioned different things have energy, but the role of the needle in acupuncture compared to something like acupressure or cupping where you're just pressing on points. What is the role of the needle plays?
That's a good question. I think it's a different way of stimulating the body. And I do believe, however, because when we place the needles, we choose the yang energy channels and the yin energy channels. If you think electronically, it's like positive and negative.
Yeah.
So when you place the needles on the positive and negative, you're creating a electronic or energetic circulation circuits. So the energy began to flow. Okay. So that's one of what needle does. I don't think acupressure can do that or can do that. Only when the needle's that. And also I have hypothesis I can be wrong. I think the needle also serves as a mediator of introducing energy from the environment into the body, or releasing energy out from the inside the body to outside. Yeah.
I have seen people use heat or that burning of that herb around the needles. That's the theory, is it's bringing that energy into the channel.
Yeah, correct. Yeah.
Well, it's been a pleasure having you. We're going to probably end here. It's about an hour. We really appreciate, Dr. Young, you coming on twice. It's very informative, very helpful. acupuncture is playing a bigger role in society and in healthcare, and we are now offering at Northern Medical Center. So it's great for us to be able to educate our patients about it and the public about it. So thank you very much. We really would like to invite you back again in the near future. So we appreciate it, and I hope everyone had a very informative session. We'll end here. Thank you very much, everyone.
Thank you. Bye-bye.